bringing together voices in child and youth healthcare. This is CAPHC Presents.
CAPHC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAPHC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAPHCtweets and using the hashtag CAPHCpresents. All of our webinars are recorded and can be found on the CAPHC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAPHC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive. Hello, everyone, and welcome to today's episode of CAPHC Presents. I'm Doug Maynard, the Associate Director at CAPHC, the Canadian Association of Pediatric Health Centres. And today we're going to be asking the question, is Canada cited sufficiently on the importance of grief in children and youth after the death of a loved one? Which is a great question that was raised to us by a very close friend and colleague in the child and youth healthcare community, Sir Al Aynsley-Green. And before I introduce Sir Al, I just wanted to make sure everyone was aware of a quick announcement. The CAPHC annual conference coming up next month, about approximately a month away, October 22nd to the 24th. In Montreal, Quebec, in Canada. Since we have an international audience today, I'd better specify it is in Canada. And we're looking forward to welcoming about 400 child and youth healthcare practitioners and administrators, researchers, children, youth, families, and policymakers from across the country to participate in an event focused on engaging children, youth, and families and asking the question, are you ready to move beyond just good intentions? So if you, it is certainly not too late to register for the conference. Anyone who is interested, please go to our website, conference.caphc.org, and please do register. We hope to see everyone there. All right, so with that aside, it is my pleasure to welcome back to the CAPHC Presents webinar platform, Sir Al Aynsley-Green. Many of you know Sir Al from his time as the first Children's Commissioner of England, and following that, he spent much time in Canada talking about his experiences there and the advancements that they made in a number of child and youth health indicators. You may also remember when he joined us on a webinar asking, where is the outrage in Canada with respect to our very mediocre performance in child and global child health indicators as identified by the UNICEF Innocenti report. Sir Al is now the Professor Emeritus of Child Health at University College in London, England, and he's the visiting professor in advocacy for children and childhood in Nottingham Trent University, and of course often finds himself engaging with governments and organizations worldwide on children, childhood, and children's services. So it's my pleasure to welcome Sir Al back to the stage. And Sir Al has brought a friend and colleague of his, Alison Penny, who coordinates the United Kingdom's Childhood Bereavement Network. And Alison has consulted with bereaved children and young people and adults on their needs and how these can be best met, and has used their views to inform national publications, practice guidelines, and campaigning tools. So it's my pleasure to welcome both of them to the stage to talk about the impact of grief in children and youth after the death of a loved one. So without any further ado, it's my pleasure to hand the virtual podium over to Sir Al Aynsley-Green. Over to you.
Well, Doug, thank you very much, and hi, guys. I'm Al, and please call me Al, as Paul Simon says in his song. And I'm speaking to you from the medieval city of Salisbury in England. And as I look out from my office window, I can see our glorious cathedral across the water meadows, built in 1350. But against that, I need to declare that I'm an incurable Canada-phile. I think your country is utterly amazing, and if I was 40 years younger, I'd be on the first plane out to try to join you. So is Canada cited sufficiently in the importance of grief? Please see what I've offered in the way of my papers and this slideshow to be a resource for you to use as much, as little, or not at all as may be relevant. I'm not Moses. I'm not coming with tablets of stone telling you what to do. What Alison and I would like to do this afternoon is to share some perspectives and above all provoke some discussion and some debate in an action-centered way. And here's my first citing shot. Can I encourage each of you, as you listen to the presentation, to write down one thing you will do tomorrow that you hadn't thought of doing before coming today. Okay, so I've got a lot of slides, and they're based on a presentation I gave in Dublin at the end of last year. It was attended by many colleagues from Canada in adult services, in oncology and in the care of the aged. And the response from them was, Al, this is a light bulb moment for us. We just never consider the consequences on the children in the family when one of our patients dies. So I'm going to share with you a quick slideshow, starting with what do we mean by bereavement and grief? Well, bereavement is to leave desolate or alone, especially through death, and grief is intense, deep sorrow. And I would propose that both are a particularly toxic combination for children. And this little image given to me by the British Medical Association when I was talking about it, I think encapsulates both of those emotions. So if we can go on to the, okay, so a toxic combination. My question to you was triggered when I was president of the BMA 18 months ago, when we came to the end of a big exercise looking at end-of-life care and physician-assisted suicide. This is a topic that created huge controversy and polarization across the UK. And the BMA produced 3 volumes of detail, but there was no child health professional on the group. There was no reference to the needs of dying or bereaved children. And I was able to raise this as to why was there no reference to children. I think it's an example of the invisibility of children in adult-centric organizations and the lack of a children's champion to speak for them. And there is a broader issue underpinning this with my experience nationally across the UK, where children, I'm sorry to say, are largely invisible in very important forums. So I was able to get an intervention. I won't expect you to read this now. It's there for you afterwards. I was able to get a couple of paragraphs into our final volume, but it was taken to our major annual representatives meeting in Belfast last year, where there was a very important end-of-life debate. And in preparation for that, I put a blog up on our BMA website, and you have the link to it, which is my own experience of being a bereaved child when my dad died suddenly at the age of 10. And of course, I'd be interested in the participants this afternoon to just raise how many of you were bereaved as children. When I ask this question in conferences, there is usually a large showing of hands from people in the caring profession. So I put this blog up on the BMA website, my own experience of being bereaved, and the response was phenomenal. 5,000 or more hits on this website within a few days, with contacts worldwide and invitations for speeches with media articles. And this exposes yet again the huge unmet need for unresolved grief in adults who are bereaved as children. And that's familiar to me as Children's Commissioner. I had a platform about bereavement, and this is an article in one of our national newspapers back in 2009, and the editor called me to say, Al, we have had the largest postback ever on one of our social affairs commentaries. So we drew a huge and emotional response. And just read some of the responses to my article on the BMA website to see how harrowing some of the experiences actually are. It was followed by an invitation to broadcast on our national Radio 4. This is the most prestigious radio program in the UK. And I had a 15-minute interview with Paddy O'Connell, a journalist whose dad also died when he was 11. And we shared our experiences. We exposed the lifelong consequences, highlighting the altruism that can follow from bereavement, but also we shared openly on air our experience of catastrophization. In other words, having experienced a sudden, unexpected tragedy as a child, throughout our lives, we were always waiting for the next disaster to happen, and when it did, there was an exaggerated response, and of course this can seriously impair developmental relationships, etc. So I have no doubt whatsoever there's a huge unmet need for many adults in coming to terms with childhood bereavement. So why? Does it matter? What can be done about it now? What should be done to prevent this unmet need developing? And what do children and young people themselves have to say? And of course, looking at the context, death, certainly in the UK, is a great taboo subject. It's a taboo recently, yet it's an everyday part of life, and it is a reality for every school. And I'll pick up this point soon. But working with and for bereaved children is a really serious challenge for adults, especially for people in faiths, whatever they may be. But it hasn't always been like this. So what's changed? Well, I just show you this wonderful painting that's on the office wall here by Sir Luke Fildes in 1891. The sick child. Here's the wise physician over a child who's critically ill. You can see the father in the background, the mother slumped on the table, and dawn coming through the window. This is an incredibly powerful depiction of a sick child, and it reflects Fildes' own experience of his beloved son dying at the age of 1. And then here is Lord Leighton's picture of the first mouth-to-mouth resuscitation of Elisha raising the son of the Shunammite. So the point is that death was real to Victorians, and these paintings had immense resonance with people, as did Charles Dickens, who wrote about his little daughter Dora, who'd been playing with her, went to a dinner, and then when he came back, she was dead. He'd left her gay and well, and it's part of the goodness and mercy of God that if we could call her back to life now with a wish, we wouldn't do it. And so he then went on to describe the death of little Nell in the old curiosity shop, and I won't read this, but it is an incredibly powerful and poignant description of the death of the heroine in the book. And so death was real to Victorians. Half of all children died by the age of 5. They were sustained by religious certainty, the existence of the soul, and the belief in the afterlife. And here we have the well-known children's hymn, "There's a friend for little children above the bright blue sky," all based on the conviction of a better hereafter. But death was part of life. It is no longer part of our lives because of complex cultural changes. It's seen to be a failure of modern medicine, the erosion of beliefs in God and the soul, the loss of hope, purpose and identity, and a meaningless end with disbelief in the afterlife. Coupled with the McDonaldization of society, we have the delusion that we are in control of our lives, and now most recently we have death being a consumer choice. And I know this is hugely relevant to you guys in Canada with your recent legislation, and I'd offer the suggestion this discussion today is highly relevant to your CAPHC program next month, where you're looking at the implications of assisted death for competent adolescents. So, bereaved children today, we argue, and Alison can confirm this, it's an under-recognized and often very poorly managed issue, leading to long-term unresolved grief. And we know from Alison's work at our bereavement network, a child experiences the loss of a parent every 22 minutes. 1 in 16 is bereaved of a friend, and 75% of 16-year-olds know someone who has died. So it's a majority experience, not a minority experience. On the right is the amazing book from Sweden, where teenagers and children talk about losing a parent. So my question for you guys is, who can these children turn to in Canada? There's a huge diversity of need with an immense range of family structures and resilience and belief. And of course, the range of ages of children we talk about is huge, from babies through to adolescents. We have the 3 main circumstances of death, which is expected death, unexpected death, and violent death. And so all of this creates a massive challenge for us in designing and delivering effective support services, and no one size fits all. We also know, and there's a vast literature on this, that there is immense short-term impact of the death of a loved one. Anxiety, sadness, longing, anger, regression of behavior, sleep disturbances, memories, fantasies, and often a serious unvoiced guilt. Wasn't my fault. My mum killed herself. And then social isolation, school difficulties, and it's appalling to hear, as I did as Children's Commissioner, that bereaved children are frequently bullied at school because of the death of a loved one. All of this can lead to underachievement in the short term. And then in terms of long-term impact, we know that overall bereaved children visit the general practitioner more for somatic symptoms. They may have a serious illness in the first year. And we know they're at risk for immediate and long-term mental health problems, including depression. More likely to misuse substances, commit crime, have low self-esteem, at risk of physical and sexual abuse, especially for girls, with an increased risk of teenage pregnancy. And of course, many children in the care of the state are there because of bereavement in childhood. Underachievement, failure to get qualifications, and risk of long-term employment. And Alison has a repository of information to support every one of these statements. But, and here's a really important point, it is not all negative. By reframing the question, do you think you're a better person? I ask this question in my circle time when I'm meeting grieving children. By the way, because of my experience, I can go into these kids and say, hang on, guys, I've got the T-shirt. I know exactly what you're going through. And it's humbling to be told by these kids, Al, thank you. Thank you for being an adult prepared to share your tragedy with us, from which we know that we too can be hugely successful despite our tragedy. And so gratitude, appreciating life and living it to the full, and this issue of altruism, using their experiences to help others, these are all very, very positive aspects of grief. But I also want to highlight some work I've uncovered about infant bereavement. Now, as pediatricians, we're all familiar with John Bowlby's amazing work on the importance of attachment in the newborn and very early years. But here are a couple of bits of work I uncovered. The first on the top left, data from France, looking at the longevity of babies. Babies born first when their mothers were bereaved of their husband being killed when the baby was in utero, compared to those whose husband was killed after the birth of the baby. And those in utero seem to have a shorter lifespan. Now, that is quite fascinating to me as a scientist. Why and how? Is it through programming of the unborn child's amygdala? Perhaps it's through cortisol secreted and stress by the mother. And then the second vignette at the bottom, after I published my paper last year, this article appeared in The Times by one of our well-respected child psychologists, an answer to a question from a lady who asked whether the circumstance of her son-in-law's bereavement when he was a baby, when his mother died in front of him, whether that could have affected his own ability to parent his children now. And Tanya's suggestion was, yes, it could. And this, of course, is supported by the book at the bottom right, this extraordinary book written by the husband of the lady who was murdered by the terrorists in Paris. And he describes in this book the way his little 18-month-old child reacted to the loss of his mother. So I do think that infant bereavement and loss can have incredibly important biological effects on children, and we should not overlook the importance of bereavement and loss in babies. So what do bereaved children need? Again, there is no doubt. You don't have to go far to find the evidence, and Alison, again, can give you that. We know they want information on what death means. They want to be able to talk about how they feel, to address fears and anxieties, and to understand their grief. to meet others and share experiences with opportunities to remember and with access to support. So what does this mean for schools? And I put here adult healthcare, but what does it mean for pediatric services? And the mantra for my article you see recently published is think adult, think child. And there are some incredible people in the UK. These are just some of the organizations. I think it's 200 organizations, Alison, that you oversee. 200 organizations across the UK, all contributing to supporting bereaved children. We also work closely with Breed Carroll and the Irish Childhood Bereavement Network. And the Irish network, how it has suddenly developed over the course of the last 3 to 5 years is quite an extraordinary story. One particular important aspect is the opportunity for children to remember. And here's a clip from one of our organizations, Winston's Wish, where children who have been bereaved come together, very often meeting for the very first time other children who are bereaved. They have fun, they play games, but at the end of the weekend, each of them is given a helium balloon with a label attached to it. And they are invited to write a message to the loved one. Now, I saw this being portrayed on a TV program about Winston's Wish when I was in my 50s. And when I saw it, I can tell you, I broke down in tears because it hit me right in the solar plexus. I had never been allowed to say goodbye to my father when he died. And this remembrance issue is very important. Here's the annual event they have where parents, children, families come together to remember a loved one. Each of them is given a light stick, all the lights go out, and all the little flickers of light emerge, all of them remembering someone who has been lost, who they loved. So, as I come to the end of this, what support should be available? Here is an image from one of Alison's information sheets, the inverted pyramid, ranging from all children being able to know about grief and death, easy to access processes, support for parents and carers, through to outreach and specialist support for those who are vulnerable and traumatized. And here is the recently published Irish Childhood Bereavement Care Pyramid with an inverted or right way round pyramid here from the bottom through to the top with complex needs. So there is no doubt about what children need and how they can best be supported. Death is a reality for every school, student, teacher, parent or family member, and of course it can be expected, unexpected, violent or traumatic. So should schools be better prepared? And how can pediatricians and children's nurses and psychologists work with schools to enable them to be better prepared? I know from being children's commissioner, it's very patchy. There are many schools who handle this very well and others where they simply don't do it, especially at particular times like Mother's and Father's Day, Christmas and Easter, when children who are grieving are especially vulnerable to memories. So I want to highlight this guy's name, Atle Dirigrov. He's utterly amazing, and he runs the only centre in the world for grief in children, and the centre is in Bergen in Norway, and I've been out there to meet him and to see his team. And his books, Grief in Young Children and Grief in Children, are easy to read, and they should be on the bookshelf of every paediatric department and every school. And Ian Gilbert's little book on the right is another very good resource. There's a plethora of literature available here. I don't know what's available in Canada. It might be an action for you guys to find out. On the right hand is Daddy Coming Back in a Minute. This is an extraordinary, heartfelt, heart-rending account about a toddler asking questions and how to answer those very difficult questions by an adult. Some other good resources, the water bug, the transformation from a water bug to a dragonfly is a useful metaphor to explain to kids. Now, finally, what about faiths? Well, I'm very interested in the rituals around death. And that was reinforced by my recent visit to Ireland, where I heard about the continuation of the wake the Irish tradition of celebrating the dead person and her or his life in their homes. I've just been to Alaska and to BC, and I met elders from the Tlingit community, the First Nation people, and listened with amazement to their stories about rituals around death. And one of the elders told me he had an explanation why perhaps so many young people were killing themselves in those communities. They weren't afraid of death. They were seeing it as part of a continuum of life. So a lot of challenges for our clergy in the Christian faiths and Muslim, Hindu, Sikh communities. What about the rituals? And are clergy sufficiently confident? Our research says they are not. So there's a lot to be said about faiths, and I'd be interested in your thoughts about this. So as I come to wrap up, think adult, think child. In adult-centric situations, consider violent death. Emergency departments where nurses, doctors, police, paramedics are very much involved. Are they aware of the importance of the news they may give to families? Then unexpected adult death, adult palliative care. What about the rituals and your funeral arrangements? Funeral directors are very important people here. And then, of course, what's the implication for end-of-life care for children and young people in hospices? I predict with 1,000% certainty that your hospices are doing an amazing job in preparing the siblings of dying children. But is that knowledge translated into the everyday pediatric circumstance where children may be dying, let alone the adult circumstance? And I just want to make some cautionary notes about counseling as an industry for it here, but how do we know it does any good? Could it be doing harm? Do you have an evaluative and evidence-based culture? Is training effective? If it isn't, should you be doing it? And here there's a big debate about it being accreditation for people who offer counselling service for grieving children. So what needs to be done? Raise awareness. And I hope this webinar might contribute to that. Let's celebrate, recognize, encourage wonderful people working in the field and advocate for better resources, better knowledge of the numbers, the mapping of the provision of services, more research and more training. And here we are very concerned about our austerity, which we know is having an adverse effect on the funding for our services. So and for the future, let's make death part of life. Let's make sure in every locality, children and families know how to access expert support. And in every school, there'll be staff trained to understand. And we are interested in bringing together all of our researchers across the UK and some kind of virtual centre. So I end with the amazing quotation from our Queen: "Grief is the price we pay for love." What does this mean for you and your adult services? What does it mean for our pediatric services? And what are you going to do as a result of today's event? Can you identify one action to take forward if you think there's a need for this to be done? And the final quotation is Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world." We can do that if we are minded to do it. So sorrow, anguish, solitude, the image of me as a 10-year-old experiencing this, and thank you for listening.
All right, thank you very much, Sir Al. That was a fantastic presentation, and certainly much more impactful knowing that it comes from a place of a personal experience of your own. So certainly some great information, and we certainly welcome any comments or questions from the audience, and please do type them in as you think of them. We're going to move on to hear from Alison Penny, as she's going to talk about, as an example, as you can tell, Al was certainly making a call for action as far as Canada is concerned. Do we need more supports, more infrastructure, more networks around supporting bereaved children? And Alison Penny is here to talk about one example of what they've done in the UK as far as setting up a bereavement network. So over to you, Alison.
Thanks so much, Doug, and thank you very much indeed for inviting me to be part of the webinar today. I'm speaking to you colleagues from London, England. The one place I would rather be at the moment is in Ottawa with those colleagues who are at the Public Health in Palliative Care International Conference. I've been following the conference on Twitter and been really encouraged by the conversations and discussions and debates that have been emerging from that really important conference. And it's in that sort of spirit of exchange of ideas and debates and discussions that I wanted to talk to you a bit today. Following on from Al's excellent presentation, I wanted to talk a bit about the work of the Childhood Bereavement Network here in the UK. We're one of a sisterhood of networks, perhaps. So we work very closely with our parallel network, as Al said, in Ireland, and also with colleagues in Germany who are coming together as a national alliance, and of course also with the National Alliance for Grieving Children in the US. And we're always keen for more opportunities to collaborate. So I'd be delighted if any of you wanted to stay in contact after today. I also wanted to just introduce one of the very nice ways in which I think that Canada and the UK have influenced one another over the last 25 years in terms of the development of services. This is a picture of Judy Stokes, who until very recently was vice chair of our Childhood Bereavement Network here in the UK. Julie is the amazing founder of Winston's Wish, about which Al has already spoken. Winston's Wish is one of the biggest providers of services for bereaved children here in the UK. They have a number of local services running in a number of our counties, and they also have a national helpline and a national programme for children bereaved through suicide and bereaved through murder and manslaughter, and also for children bereaved in military families. Julie worked in palliative care and was struck very deeply by the need for better support for the children of patients who were dying, so adult patients with children or grandchildren. And she was also linked up very closely with pediatric palliative care as well. And she, 25 years ago, was given a travelling scholarship and came to visit Dr. Balfour Mount at the Royal Victoria Hospital and McGill University, and was very influenced by his work and his inspiring words. And when I was reading a bit about the connection between the two of them, I realised also that he himself had been influenced very much by Dame Cicely Saunders, who was kind of one of the founders of the palliative care movement here in the UK, and is still very influential in terms of the thinking about how to support bereaved families and those associated with dying patients. So a nice example, I think, of that kind of international collaboration, and as I said, we're very keen to support and promote that. We have a network in the UK now of around 250 organisations and individuals working with bereaved children and young people. Winston's Wish, as I said, is one of our member services. And the things that those services are trying to do range really in thinking about direct support for children and young people, and there are 6 key things that those services are trying to do. We spoke recently, and I'll talk a bit more about a piece of work we've been doing around coming up with a kind of an outcomes framework for our member services. We talked to children and young people and to parents and carers and to people working in services about what was it that they were trying to do. And the 6 main things that services are trying to do, and I'm sure this is very similar to the work that many of you are doing. One was around helping children and young people identify and communicate with supportive family members and friends. So the services that we have here that work with children and young people, either on a one-to-one basis or with groups of children and young people, know that they can't provide support to children 24 hours a day, 7 days a week, and it's really important that they help young people find the people in their existing networks who can support them and help them find words to open those conversations. Most of our services also work directly with parents and carers, so both parents who've been bereaved of a partner, widowed of a partner, and those bereaved of a child, to support their child, whether a sibling or a parent has died, to support the child through that experience. A lot of the work is around helping children and young people to understand grief, and by that I mean both their own grief, but also the grief of others around them, and how that, in a kind of family dynamic, can be so difficult for different people to manage if different people are grieving in different ways. So helping children to understand how grief can manifest itself. There's a lot of work as well, of course, around, we originally described this as teaching coping skills, but actually so much of it is around reinforcing coping skills that children and young people already have, and I think it's really important for us to celebrate the resilience that many children and young people do have and help to scaffold that where we can, but really giving ideas to children about how to deal with their thoughts and feelings. And that's not just adults giving ideas to children about how to do that, but many children and young people supporting one another. So often one of the most fruitful ways of doing that work, and I'm sure this is very, very similar to those of you working with groups of children and young people, is actually helping them to help one another. A really key part is around helping children and young people to understand what's happened, so to get the story straight, to understand why the person died, what happened, that it wasn't their fault. So explaining about the cause of the death, and getting some of those kind of conceptions or misconceptions about causality, getting some of those straightened out, but also helping them to understand what's happening now and what might happen in the future. So helping them to understand that they will be cared for, and that plans are in place to support them. And then crucially, as Al has already said, giving opportunities to remember the person who died. So that's what our individual members are doing in the UK, again, along with colleagues elsewhere in the world. What we found when we started to explore the possibility of a network between those individual organisations was that practitioners here felt quite lonely in their practice. They were wondering about whether they were doing things in the right way, or whether there were other ideas that they could use to support the children in their care. They really wanted to know about other services nearby as well. Often, a lot of our services have very strict geographic sort of referral criteria. And one of the hardest things, I think, for professionals is when a family rings up and says, "Can you help us?" And the service has to say, "I'm sorry, you're outside our catchment." And so knowing about neighbouring services and being able to refer families on has been a really important part of the work. Practitioners wanted to share resources as well. They wanted to kind of get ideas about what was out there that they could use in their practice, and they also wanted to share the good stuff that they were doing as well. And they wanted to come together to develop consensus about what is good practice, what does that look like. So as a network, we operate across the UK. So that's all 4 nations: England, Northern Ireland, Scotland and Wales. And that has some implications because each of those nations has, to some degree, devolved health and education policies. It means that we have to keep abreast of quite a lot of different policy and how that impacts on bereaved children and families. But across the 4 nations, we're trying to do 2 things. One is around improving the range and quality of support services, and one is around increasing access to support services, so making sure that they're available to all children who've been bereaved. We know that services are really patchy at the moment. So our work centrally operates around four key areas. One is around advocating, supporting professionals, signposting and generating new ideas, which is one of those lovely catch-all objectives which allows us to do lots of interesting things. I'm just going to talk briefly about each of those 4. So the first one is around advocating for bereaved children. Just a couple of things that we do. We recognise International Children's Grief Awareness Day, which I know falls this year on the 16th of November. For us, that kicks off a week of activities which we coordinate here in conjunction with Grief Encounter, one of our key members, and members across the country, really trying to raise awareness of the needs of bereaved children. We also try to influence national policy wherever we can. So the front page newspaper that you can see here is the Guardian website, which is one of our major broadsheet newspapers here, which along with large other swathes of the press, got very involved with a campaign that we ran earlier this year around cuts to social security for widowed parents and their children. So we've had some very significant changes to the benefits structure for widowed parents, which we think are going to have very big impacts on families. So as a network, we've become more interested in thinking about the wider safety net for families beyond the provision of specific emotional support. We're thinking about the provision of financial support and practical support as well. So, as well as advocating, we support professionals wherever we can to find and share their knowledge. So that is often about producing specific resources. We know, as I said earlier, that there is a real patchiness of provision. So it's important for us, where we can, to try and support new services to be set up. So we do quite a lot of work around supporting and the development of new services in new areas. Third area is around signposting families and professionals to sources of support. And if I just come out of the presentation, I think I'll be able to show you our website, which has a map of support provision for families that they and professionals can search. And I'll just go back to the slideshow. And then the fourth area is around generating new ideas. And just to give you one example of that work that we've done together, and I'd be really interested to hear from those of you that have been working on similar projects. We've been doing a piece of work around developing an outcome framework. So one of our key academics here has pointed out that evaluating services and making sure that services are making a difference to children is a really key issue for the sector, and the burden of evaluation is very high, but that services take it very seriously as well. We're quite good at collecting evidence about how satisfied children and parents are with the service, but we're not great at evidencing how things have actually changed for them. So Liz recommended that we come together as a sector to try and articulate what it was we're trying to do for children and how we could measure that. So this is a group of our members hard at work. We talked to those key stakeholders. So we talked to children and young people, to practitioners, to parents, to referrers. What is it that they wanted services to achieve? What did they want services to be working towards? And then we worked together to develop a set of questionnaires which can be used before and after children and young people take part in a service to help them identify actually where things have changed for them. So this is an example of the questionnaire for young people. And we think we've got about 30 to 35 services that are using those as part of their routine practice. Couple of things that we're planning to work on as a network together. So we wanted to have more of a focus on support before a death. We're really conscious that that time when children are facing the death of a sibling or a parent is such a key moment, an opportunity for support. And actually, as we know from Grace Christ's work at the Memorial Sloan Kettering Cancer Centre, that can be the time of the greatest anxiety for children. So what support can we put in place at that point, and how can we measure its impact as well? And we're also really interested in looking at some of the cost savings that child bereavement services bring. It feels doesn't always feel too comfortable to be kind of looking at the sort of the market value of these services when actually morally we know that they should be available, but in a climate of needing to demonstrate outcomes to commissioners and to funders, actually it is really important for us to be able to demonstrate the cost savings that good quality bereavement support can make to other parts of welfare and social services provision. So those are just that's a bit of a gallop through really some of the things that we've done as a network. I strongly believe that these are things that, I mean, we clearly couldn't have done without our members, but actually our members have really contributed wanting to be part of something, they feel by coming together that we can be greater than the sum of our parts, and that's been the real joy, I think, of collaborating in this way. And it feels very similar, I think, to the model that you have at CAPHC about bringing organisations together to collaborate wherever possible. So we think that networking works, adds value, but it does obviously require effort and resources. But it would be great to hear from any of you about examples of networking to improve outcomes for children in your context. Thank you.
All right, thank you, Alison. A great presentation, a great sort of example of what a network could do, and I think everyone really would agree with you that that outcomes focus is a particular challenge to do, but certainly very important to be able to sort of focus on outcomes. Are we actually making a difference for these children, and identifying, in fact, what is that difference that you want to make? All right, so we're now going to open it up to the audience for any questions. So please do type your questions into the question box, and we'll bring them into the conversation. The one question that came in was related to these bereavement episodes that we're talking about. We're often using the examples of parents that have passed away, a parent or perhaps a grandparent that has passed away and has caused this grief. issue. But with children's hospitals, we're often dealing with children who are dying, and many of those children have siblings who would be experiencing grief at the death of a sibling. Of all of the things that you sort of talked about, the general sort of concepts, and this question could go to either one of you. Are these concepts universal, whether it's an adult who has died and left a grieving child, or a sibling that has died? Are all of these concepts relatively universal, or would there be unique aspects to the death of a child sibling?
Shall I come in first? Just to sort of respond, I guess, in terms of most of our members here in the UK would work with families with children who have been or are facing the death of a sibling or of a parent or somebody else important in their lives. And I think there are many similarities and many benefits to, particularly if we're thinking about peer support, to bringing children together across that range of experience. And certainly there are many benefits that children and young people have talked to us about in terms of kind of gaining an understanding of coping strategies from those bereaved in other circumstances. I think that there are always going to be some questions, some sort of existential questions that are very different for children who are facing the death of a sibling or who have been bereaved of a parent. And so much of that to do is about how the family reorganizes itself following the death. So the sorts of challenges that parents might have in grieving together over the death of one of their children while parenting the other children, the sorts of milestones that family are going to face as younger children reach the same age as the child who died, the sorts of challenges around managing to kind of attend to the needs of siblings when, of course, the child who's dying has to be supported through so much medical treatment. So there are always going to be those sort of differences, I think. But I think there are. I mean, certainly, as I said, most of our members would work across both groups. And what we found, interestingly, was those 6 things that services were trying to do. Those did work across support for children when a sibling had died and when a parent had died or somebody else. So the outcome measure that we've been developing is intended to work across those experiences.
Thank you, Alison. I mean, just 3 very quick points on this. The first is that children are in a dynamic state, of course. They don't stand still. They're growing up. Their cognitive development is changing, and so their perceptions of the death of a sibling or of a parent may well change as they grow older. 2 other very quick points. We recently had 2 major catastrophes in the UK, the bombing in Manchester and that terrible tower inferno. Now, very large numbers of children have been affected by both of these catastrophes, and there's a big debate about localities, government being prepared for catastrophes in localities. And so here's yet another dimension of this big story. And my last point is to emphasize the similarities and differences between bereavement and loss generally. Now, loss affects many, many more children through family breakup or whatever. My personal view is that death is slightly different because there's an inference of finality and permanence about it. Now, Alison, you may have a quick point to make about loss versus bereavement.
Thanks, Al. Yeah, I mean, it's something that kind of comes up again and again in our advisory group meetings and when we're thinking about the membership of the Childhood Bereavement Network. We have kept a focus on bereavement through death, and that's partly because there are such very specific issues that are raised, both in terms of kind of broader practical and financial support and challenges, and then also, I mean, I was making the point about the existential questions earlier. I think for children who are dealing with other forms of loss, perhaps separation and divorce, the sort of questions that they might be grappling with are about the the fragility of human relationships and kind of human frailties, whereas for children who are dealing with the death of somebody in their lives, it is, as Al said, that those issues of finality, but also, of course, questions about what happens after we die, and some of those kind of quite different issues. Having said that, a number of our members do, again, bring children successfully together who are experiencing different forms of loss, and particularly the Seasons for Growth model, which some of you may be aware of, which originated in Australia, takes children who are experiencing change and loss through a program which is based on the seasons of the year, and children self-refer to that program and bring their own experiences of loss, which might be very various, but there have been found to be benefits to children of hearing from one another's experiences. But I think even within those groups there needs to be room for children to ask and explore those very particular questions that might be pertinent to their specific experience.
All right. We do have another question here, and this one is for you, Alison. The person asking, Lisa, is a counselor at the Dr. J Children's Grief Center in Toronto, where they work with kids and families, both pre and post-death. They've been working both on developing a regional alliance for agencies serving grieving children. They dream of a national such as yours, as well as service evaluation measures. They would love to see the tool you described using with your network, and how best could they contact you to pursue and share perhaps a tool and implement something similar. And I think she's referring to those outcome measures and that sort of thing.
Oh, I'd be absolutely delighted to talk. I can talk about them for days, actually. Sorry, Lisa, it might be a rather long conversation, but I'm really happy to collaborate, absolutely. The easiest thing to do is probably just to drop me an email. So it's apenny, that's all one word, APENNY, at NCB, that stands for National Children's Bureau, ncb.org.uk. But you can also find me through our website, which I think you've got details of as well. If you drop, we're so tiny actually, it's me and our administrator one day a week. So if you drop us a note through the website, it'll come to me and we can make contact that way.
You have access to links to the Bereavement Network's website on the Knowledge Exchange Network, where you would have registered for the webinar and where the recording will be posted, so you can at least get to the website through that, and hopefully eventually find your way to Alison. Joanna was also asking about the Children's Grief Awareness Week, and she was just wondering if you could give some of the examples of activities and services that you offer during the Grief Awareness Week.
Of course. So last year we had a theme of make time to listen. So we published some findings. We have a tradition here of birth cohort studies, so longitudinal study, very large scale longitudinal studies that follow the outcomes of children. So our Millennium cohort study, children had reached the age of 11. So we published some findings about the similarities and differences between children who'd been bereaved and those who hadn't. And we got a bit of media attention around that. So we were particularly finding that bereaved children were less likely to share their worries. They were more likely to keep their worries or concerns to themselves. So we published some findings around that. Quite a number of our members used the week, as we'd hoped, as a way of raising awareness in their local communities. So they used it as an opportunity to go in and do some training in schools, and also to run some open sessions as well, so that people could sort of have a bit of an insight into the work that they were doing. We also collaborated with colleagues in the US who were coordinating a thunderclap on Twitter, which I think reached something like 1.2 million people. So we were very proud about that. But that again was kind of an opportunity to raise awareness. We also ran a campaign, a sort of email campaign, encouraging people to get in touch with their members of Parliament. So asking people either to write to their MP or to go and visit them. So we produced some guidance about how to make an appointment with your MP, and then once you've got the appointment, gave people some suggested briefings and statistics and key points that they might want to raise in raising awareness with their MPs. So what we try and do is produce some resources which really members can use in their local areas. It's very much intended to be a collaborative effort. And Grief Encounter, our partners, had an excellent partnership with Lola's Cupcakes, which is one of the bakeries that are often found at railway stations here in the UK. So we got quite a lot of coverage through that as well. So it was, some nice examples of partnership working.
All right, so some great examples of some opportunities to raise awareness for sure. Thank you for that. So the last question we have here, and we do have about 5 minutes left in our scheduled time. So if you do have any last questions that you would like to type in, please do. But the last question that we currently have is from Tim, and he's asking, he's commenting more, when it comes to the question of qualified persons available to offer grief support, he finds that persons need to ask about the connections that the family already has. For example, if the family or child has good connections with the school, then they may be open to the resources available that might include speaking to a counselor within the school, or in terms of the faith community, if the family or child has a pre-existing connection, then a faith leader may be well prepared to support them in their grief. So do you have any comments about that, sort of helping identify the most appropriate person or group to support the grieving child?
Shall I chip in? Just quickly, I think quite often children will find will have quite strong preferences for the person that they want to talk to. So particularly in a school setting, it might not be the class teacher. It might be it might be the janitor or the librarian or the school office staff, and so that's one of the reasons why we would advocate for the whole children's workforce having some awareness of the impact of grief on children and knowing where to get some extra support if that's needed. And by extra support, I don't necessarily mean referring children on to a different service. I mean sometimes that adult just being able to get a bit of backup, having some consultations maybe with a specialist service, but knowing that they often are the best placed person to offer a friendly listening ear and to be able to provide that sort of continuity of support. I think it is really important to sort of build those networks of support around children. And Tim, exactly as you said, that often there will be really well-established support networks there already. Often it's about giving those people just a bit of confidence, helping them to understand how children's grief manifests itself, and that by acknowledging the children's grief, they're not going to be making things worse, but giving them just a few sort of pointers about how they can respond kindly and appropriately, and then also knowing when to call for backup as well.
I've been going to Vancouver for the last 25 years, and I'm just in awe of UBC's program, the Human Early Learning Partnership, and the fundamental importance of mapping children's lives by locality. And I think an important point in this conversation is to get a handle on mapping your local community. Who's already doing the work, and then from that, what might be needed. And I would also suggest again that the school is very, very important. The school is the center of the child's life, and one of Atle Dirigroff's key points for his catastrophe management is trying to restore a sense of normality to the child by school. So we are really trying very hard to get an interface with education, making sure every school is aware of the impact of bereavement and grief, and to build on it. I think my next point is coming through loudly and clearly to me as I walk around the country is the incredible complexity now of children's family lives with multiple relationships, etc. And this can cause some quite tricky difficulties in unraveling these relationships.
All right. So the next question that we have, we did have a couple questions come in. This is an interesting one. Marjorie's saying, she's wondering who the champions would be within the adult centers to promote the awareness around this, or who would help lead this, and also in the programming or supports of childhood grief and bereavement. She says, for example, in children's hospitals, at least in Canada and the United States, I'm not sure how widely around the world they have these positions, but there are child life specialists who are often the professional group that leads these kinds of topics around bereavement. So who in the adult setting would be the potential champions in your mind that would help lead and implement something like this?
Well, if I can just make a quick comment based on my presentation at the Royal College of Physicians of Ireland, at which were present adult oncologists and geriatric specialists from Canada. And they made the point that nurses, they felt, were the most important people to ask this question: think adult, think child. What does the death mean for the children? They felt that physicians probably were not cited sufficiently on this, but nurses certainly were. So I just put a marker down for the importance of nurses in our communities.
I'd just like to reiterate that absolutely. I think there's a hugely important role of nursing staff. I also think that anyone who is listening really carefully to the patient's needs is often going to realise the significance of taking a family perspective and thinking about the children in the family. So often, particularly when it's a young parent who is dying, their main concern will be for their children. And for anybody providing direct healthcare support and making kind of treatment decisions with and for that patient, to be truly responding to their needs, they if they're listening, they will realise that the children are very much at the centre of concerns for that patient. I think often it does take one champion. No, go on.
Okay, just to flag the importance of faiths and of funeral directors, we had an event here in Salisbury Cathedral led by our bishop, where he brought together 30 of the country's experts on the development of children's spirituality, alongside clergy of various ranks and level. And there was a free acknowledgement that funerals are the day job for clergy for adults, and they cope with them okay. There was an agreement that relating to grieving children was a very, very different species, and many clergy agreed that they were unprepared, they didn't know how to talk about it, especially the metaphysical aspects of death and hereafter, resurrection, etc., etc. And that, in turn, led to a discussion about the importance of local funeral directors. Now, we do know, and I've reported this in my paper, there are some funeral directors here who work with schools and providing resources to understand death. And they are also perhaps the most important people for the family in arranging the funeral. And they got a lot of experience and are willing to contribute to this discussion.
All right, and with that, I think we have almost exhausted the questions from the audience. So there's just one more comment from the audience here, and then we are out of our scheduled time, and we'll just hand it back to each of you just for any closing messages or key messages that you'd like to leave the audience with. But Lisa, who asked the question earlier, has indicated that there's a new website that we'll be launching called Kids Grieve 2, and I believe the website will be Kids Grieve, one word, and the number 2.ca. It's not open yet, I just checked, but it looks like it's from an organization called Canadian Virtual Hospice. So I'm not sure what it's exactly going to have, but people may want to check that out. They do have a webinar on their website about this Kids Grieve 2 website. I don't know anything about it, but it may be there may be some interesting information coming soon from that group. All right, and with that, I just want to thank everyone for coming, the audience for coming, some great questions, and Alison, maybe we'll just start with you, and just any sort of key messages as following this interesting discussion we've had at the end. Any key messages you'd like to leave the audience with before we sign off?
Well, I guess we've talked about networking in so many forms, haven't we? Partly about the virtues of bringing organisations together, both in terms of this webinar and also across particular nations. I think that in a way is kind of modelling what we want for children and families, and building a network of support around them that involves all of those involved in both the patient's care and the family's care, the schools, the community, funeral directors, and then specialist services as well. But friends and family of real importance too.
All right, thank you very much. And Sir Al, always a pleasure to have you on our webinars. Anything you'd like to leave the audience with here before we sign off?
Well, yes, thank you, Doug. I'd like to come back to the exam question that we posed in the title. Is Canada cited sufficiently on the importance of grief in children and youth? Well, I don't have a sense of an answer to that. And can I propose that through you, Doug, the participants might be able to say yes or no? And if the answer is yes, that's absolutely wonderful and well done and build on it. If the answer is no, then what actions should follow from this? Look, I spend my life ricocheting from meeting to meeting where we navel gaze. A lot of hot air is expressed and nothing comes out of the meeting. So I would venture to suggest from this webinar what actions might come out of it that could improve the lives of children who are experiencing the most human of circumstance, which is the loss of a loved one. But thank you, Doug, for organizing this. And if necessary, we are delighted to support and help you in any way we can with this across Canada.
All right, well, thank you very much for coming and bringing all this great information, and we certainly will be happy to connect anyone who's looking for more information or wants to partner or anything. If you have any difficulty connecting with Allison or Al, then just please let me know, and I'm happy to make that connection. But thanks again for joining us today. All right, with that, we'll wrap up. We do our webinars every Wednesday at 11 a.m. Eastern Time, and it's great when you can watch live, as we do have these really great discussions. But if you can't watch live, we do record them and make them available after the fact on the Knowledge Exchange Network. Next week, on September 27th, we're going to be hearing about pediatric clinical deterioration when things go from bad to worse. And this is about a project about parents and providers working together to address that. We're going to hear the personal experience of Sabina Robin, the parent of a child who deteriorated rapidly and unnoticed in hospital, and the consequences of that. And then we're going to hear from Dr. Chris Parshuram and Kristen Mada from the Hospital for Sick Children in Toronto about PEWS, the Pediatric Early Warning System, which is a process for identifying early identification of clinical deterioration. And we're also going to hear from Joanna Noble of the Health Insurance Reciprocal of Canada to talk about the importance of an early warning system from a risk management perspective. So that's going to be an interesting session there. And then we're going to hear from Dr. Eric Benchmal after that on October 4th about using routinely collected health data for research and quality improvement, the importance of methodology, validation, and transparency. And Dr. Benchmal is going to emphasize the advantages of using this routinely collected data. And he's talking about data that's collected at every institution almost every day about how to improve data quality and perform research with this data. But also he's going to talk about the perils and pitfalls of using such data. And he's going to talk about the ways in which the record, that's an acronym, of the reporting guidelines have helped improve transparency of reporting of research using these data while shining a light on the importance of the methods used in research and reporting using this valuable source of information. So some great stuff coming up in the next couple of weeks. And that webinar on October 4th, I believe, will be our last before we take a short break before our annual conference, as I mentioned, coming up in October in about a month in Montreal. And again, if you do want to register for the conference, we do have a session on palliative care and medically assisted death in youth and mature minors at that session. So again, potentially a topic of interest for those of you who watch today. Please go to our conference website at conference.caphc.org, and you can check out the program and hopefully register for that, and then we'll get a chance to meet everyone in person in Montreal. So some great stuff coming up in the next couple of weeks, and we hope to see you back next week for the webinar and potentially in Montreal. All right, bye everyone. Thanks again for coming.